I didn't like to talk to nobody. I was always by myself. I didn't like school. It was hard.
Why?
Because I was getting hard to learn.
Delfina has always been a very lonely person. She has always been very angry, aggressive. She would never play with my other children.
All the time I used to be mad and I would not talk to nobody. I was always mad. And they did take my kids away from me for almost 2 years. And I was fighting for them, and it was so hard till I met Yvette, and she started helping me. Everybody started helping me.
The most rewarding thing is actually seeing her now. Seeing the fact that now her children are in her life, that she is actually happy, that she even actually wants to live. Because beforehand, she would say that if her children were not in her life, then she was not going to even want to live, that there was no reason for it. And so I think seeing her now, seeing the change that she has gone through, is very rewarding.
So when we became involved, CPS was heavily involved. They were about to remove children and end parental rights. But when START became involved, we were able to talk with the whole team, CPS, and let them know we're all a team, we're working together with Delfina, and together we came to a common ground on how we can all work together to help her. And this program was developed specifically for the IDD population because they had a lot of challenges. They had verbal challenges, they had medical challenges that mental health professionals could not identify. So there was times where we've encountered individuals that had IDD who were suffering from gastrointestinal issues, and no one was able to find that out because they just treated what was visible, which was the MH symptoms or the IDD symptoms. Because it's easy to describe someone as angry and upset, but what is causing that anger? Is it anger or is it frustration that they're not able to communicate the way any other person or express what they're really desiring or what their goals are?
But prior to START team being established in El Paso, individuals that had a developmental disability that went into crisis would go through the exact same system that an individual with a mental health diagnosis that experienced a crisis. They'd go to an emergency room. And again, our emergency rooms are not equipped to really handle psychiatric crisis. Nevertheless, the developmental disability behavior crisis. Most psychiatric hospitals are also not equipped to really properly treat an individual with a developmental disability, again, because the root cause of their behaviors, of their aggression, of their acting out is not a psychiatric diagnosis. Our START team is trained to really dig down and find out what the root cause is of this aggression or their acting out behaviors to address those behaviors rather than immediately turn to some sort of medication or inpatient placement.
Before I was thinking that nobody cared about me, my family, or nothing. And when START got involved, there were too much people, and I started thinking that they did care about me. And I started fighting my depression. Now that I feel better, I can communicate with my kids, with my mom, my family. When I was doing bad, they didn't want it to be around me. So now they go and visit me. I go to their house. We make, with my sister, we make cookouts.
It was very hard for me because I didn't know what to do, how to get her help, until she got into this program. I feel like I don't have to worry anymore, and I thank them for giving all the help they given my daughter.